here we have a lovely patient. She has a really ingrown nail, as you can see, and she's got this red growth on the side of the nail, and we call that a granuloma. Now that forms because the body is trying to reject whatever it's perceiving as something foreign. So it's thinking that the nail shouldn't be there, so it's trying to express it out. So what we need to do is we need to actually get the corners of these nails out, and then we're gonna remove these little granulomas today. So that's the plan, okay? So granulomas, what we talked about, these little red fleshy things, they bleed a lot. So that's why we use this little blue ring. We call that a toe tourniquet, so that we don't have any bleeding going on. We like a nice clean procedure site, okay? So now that everything is lifted, we're actually gonna cut the sides of the nail and then remove them for the big reveal to see exactly what was in there. So this instrument's called an English anvil, and you hear that wonderful sound. Okay, one side's done. All right. And there's the other one. Are you feeling any pain?
No, not on that one.
Excellent. All right. So now we come in with our hemostat and we make sure we go all the way down to the base. We turn it away from the nail fold to be able to get it to come out. And there it goes. One's out. So we're gonna put that on the top of the foot so we see what it looks like. Pretty big. And here's the other side. One more. There it goes. So that white, fleshy looking stuff at the base of the nail, that was actually the nail matrix, which tells us we removed all of it. So there's nothing left inside, which is exactly what we want. But here's the granulomas, which are really interesting, right? The body created these trying to remove that nail, but it was never gonna be able to do it. So they keep growing and growing, and in her case, they got pretty large. So we're actually gonna remove those and cauterize them. So we use a tissue nipper. I'm sure a lot of you can recognize this. We just gently cut them out. There's one, and then the next one.
Just for medical students.
There it goes. I come back in, make sure there's nothing left. Okay, and we're nice and clean. So now we're ready to actually phenolize or kill the matrix, which is what actually produces the nail. That way we won't get this problem again, okay? So we use our phenol. We use a very skinny cotton tip applicator, and this goes all the way down. And this is kind of the funny looking thing where you have two sticks coming out the end of your toe. Like that. And we like to turn these away from the nail fold, and that prevents any of the phenol from getting underneath the healthy portion of the nail. We like to do a 30-second application, give or take. I look at the clock, or I count in my head, and we do 3 applications. All right, so that's one. That's another one. Are you peeking up there? How are you doing? You doing okay? All right. No pain?
No.
Nothing. Good. You're doing really good. Real proud of you. All right. Our patient here had a little bit of anxiety this morning, but she was really brave and she let us do the procedure, and she's been doing awesome. No pain. She's comfortable.
In short, it's called trypanophobia.
What was that? Trypanophobia?
Trypanophobia, it's the irrational fear of needles.
There you have it.